Sure. And the co-chairman is going to be our first vice president, Boyeji. I think the governor's representative is probably on our way or on his way. So we're going to try and make it like 15 minutes each of these mini sessions. The first one we're going to be talking about is Sogon Partnership for, the presidential session this year is focusing on the projects that Sogon is doing, so that we can allow members to appreciate what the association has been doing in terms of projects. Because we know the association survives basically as an NGO, and then we handle projects. So the first mini session, is going to be the Sogon Partnership for Training Health Workforce in Essential Gynecological Skills. What are the achievements and lessons learned? Our speaker is going to be the RCOG, Nigerian Liaison Group chairman of the Nigerian Liaison Group of the RCOG, Professor Sam Agu. Please, can you sessions is Professor Ifeanyi Ezebialu. I don't know if you are here. Dr. Sule Gaya, please come on stage. Dr. Odigoma Ikpeze, please come on stage. And myself. Then the second one will be our Amplify project. That's the Accelerating Measurable Progress and Leveraging Investments for Postpartum Hemorrhage, the Impact, the Sogon Advocacy Initiative. And the speaker will be Dr. Aisha Nana Adamu, PhD, who is the champion of the project and the lead, Sogon lead for the project. Please come on stage. So we'll start off now. With the presentation by Professor Sam Agu. I'll quickly just read a quick profile of Professor Sam Agu. If I'm going to read his full profile, University of Nigeria, Nsukka College of Medicine. He moved to the United Kingdom to complete specialist training, was the RCOG preceptor in benign gynecology, became a consultant in the United Kingdom in 2005, and is the former clinical director, Worcester Women's Health in the United Kingdom. He was the lead fetal medicine specialist at the Worcester Royal Hospital, and he joined the RCOG Global Health Center for Women's Global Health. He has done extensive work in global health in Africa and Europe, and is a clinical visiting professor in the University of Nigeria, Nsukka, and the chairman of the Nigeria Liaison, located to the United Kingdom. He's the man to see. I've seen him already and I've settled myself. He's the United Kingdom Clinical Head of Gynecological Matters and Global Health in Nigeria. I want to welcome to the podium Professor Sam Agu to make his presentation entitled, which is about the Sogon Partnership for Training Health Workforce in Essential Gynecological Skills, Achievements and Lessons Learned. Professor Agu. Please clap for him.
Thank you very much, Chris. Sogon President, Sogon First Vice President, members of Sogon Council, the ex-president, who I can see, distinguished professors and colleagues, and distinguished guests. It is my pleasure to stand before you today to share with you some of the activities we've been doing with the leadership of this great organization. So, with the permission of the first Vice President, I had to modify the title of this talk to Sogon Partnership for Training Healthcare Workforce in Nigeria, Transforming Women's Health through International Collaboration. So, the overview of my talk today will center on the Gynecological Matters Program for Nigeria, and where it is pivoted in the essential gynecology skills training So we'll be looking at what the Gynecological Matters program is all about. We'll look at the essential gynecology training, its structure, then achievements, and if we've got some time, we will look into the future. As a member of the Center for Women's Global Health, it's important to let you know some of the work we do. So the Center for Women's Global Health in the RCOG, in-country partners, and also our members to promote access to high-quality sexual reproductive care, gynecological and maternal health services to ensure that women and girls can realize their right to health. This is also critical in achieving the Sustainable Development Goals 3 for reducing maternal mortality and the Sustainable Development Goal 5 on achieved countries around the world. So I have no interest to declare here. So what's Gynecological Health Matters? The GHM program improves women's health by increasing access to high-quality gynecological services through advocacy and training. It uses a training which was developed by the RCOG to teach essential gynecological health to multidisciplinary healthcare providers to ensure that women and girls access the gynecological services that they need at the point of entry into the health system. Currently, the RCOG is working with partners in Bangladesh. In fact, a 2-year program is running there. And of course, here in Nigeria to deliver this program. And we are hoping to expand to Rwanda in the near future. Gynecological disease is significantly under-prioritized globally, you will agree with me. In 2019, almost 8% of all years that were lost due to disability for women aged 15 to 49 in low and middle income countries were due to non-cancerous gynecological conditions. Over 164 million women currently have unmet need for contraception. And over 2 million young women live with untreated obstetric fistula, which we all know is a preventable and treatable condition. Cervical cancer still ranks the 4th commonest amongst our women. And in 2020, 90% of new cases and deaths occurred in low and middle income countries. So there's no doubt that there are far-reaching consequences of gynecological conditions that affect women throughout their lives. A research that was commissioned by the Royal College analyzing data from the Global Burden of Disease database examined the impact of conditions such as endometriosis, infertility, heavy menstrual bleeding, and fistulas on women's life, and highlighted how these long-term diseases impact on our women. And we know that stigma and lack of knowledge or loss of knowledge among healthcare providers. Gynecological Health Matters. It is a tripartite partnership between RCOG, the SOGON, and ASEP, which is the African Center for Excellence for Population Health and Policy, based in Bayero University, Kano. The program is sponsored by the UK government through the Department of Health and Social Care, and is managed by our global partners as well, formerly known as TET, but now the Global Health Partnership. They've just changed their name last week. And then the next fund holder is the Ducid Blue Solutions based in Nigeria. So the GHM in Nigeria is delivering training to multidisciplinary healthcare providers from 6 facilities in Nigeria, 3 in Kanu and 3 in Abuja. And this is to enable the healthcare workers identify and treat and manage gynecological conditions at the earliest stage with the EGS comprises 11 modules covering a range of gynecological topics, and we will be talking about this later. Prioritizing women's gynecological health will enable women and girls to achieve their human rights to health. It will help women and girls to achieve greater equality and participate more fully in society. It will ensure a more equitable use of scarce healthcare resources and reduce women's risk of suffering long-term chronic pain and developing other non-cancerous conditions. And last but not the least, it is very critical, as I said before, in achieving the SDG 3 and SDG 5. A lot of progress has been made on tackling women's health issues over the last 25 years. Most attention, though, rightly, to date, has focused on tackling maternal mortality, and a lot of advances have been made in that direction. However, a huge burden of disease and preventable suffering still exists because of gynecological conditions or unmet sexual reproductive health care needs, which are under-prioritized at both national and international levels. So why EGS? EGS was introduced because of the huge global burden of gynecological diseases. We know that those conditions are underrepresented in terms of general resource allocation, training, and research. We believe too that EGS will elevate the status of gynecological disease as a global health priority. And we know that the bulk of care is delivered at the frontline levels by non-specialists who do not have the options of continuing medical education. So we think that EGS may start to address some of these problems. So we do have 11 modules across gynecology, from basic reproductive sciences and clinical skills, where we teach structural history taking, gynecology examination, and indeed general good medical practice, down to contraception, STI, HIV, emergency gynae, and management of the acutely ill woman, emphasizing on resuscitation and the use of the early warning scores to enable healthcare workers triage and prioritize patients, especially in emergency situations. We do have abnormal uterine bleeding, cervical cancer, early pregnancy, subfertility, urogynecology, and violence against women. And also we know that as we practice, we want to examine our practice, we want to improve, so we introduce the clinical audit into the modules. So these are the 11 modules of EGS, which we impart. The idea of EGS actually started at about in 2013, when at the onset a group of experts and authors and trainees from UK were invited to submit content to the handbook and lectures and breakout sessions. The content has so far undergone several rounds of peer review and revision and reiteration to where we are today. Each module consists of 1 to 2 didactic lectures lasting 15 to 1 hour. The lectures are followed by interactive breakout sessions of skills teaching, case-based discussion and scenarios, and group discussions. And it is supported by 2 comprehensive facilitator and trainee manuals. So it generally promotes a human rights approach, being non-judgmental and respectful and compassionate as we offer care. Several pilots were done before rolling it out. A few in the UK, 2006, and then followed by international pilots, part of which happened in Nigeria, and then followed by the first rollout, which was done in the Federal Capital Territory, Abuja. And I remain grateful to Professor Archibong, Professor Ekele, and Frank Alu, who actually led this rollout at that time. And based on some health outcomes, you could see that 23% of unmet need for contraception still existed. Cervical cancer rate is still, at the time, 20.3 per 100,000 compared to European rates of 2.4. And then you look at the workforce, surgical personnel density, which we saw at that time, was 0.0136 per 1,000. And the recommended minimum for SDG is 4.5. And I'm sure it's worse at this time, taking into account the current JAPA syndrome. So we know that the workforce is depleted. And this is why we think Nigeria will need a gynecological health matters program. And the objectives will be to increase the number of skilled healthcare providers who can provide high quality gynecology, to advocate for prioritization of within their respective facilities. And we hope that we will be able to generate evidence of impact to secure commitment from the government of Nigeria to include the rollout of EGS training within its national health funding plans. We also hope to demonstrate that the GHM is a deliverable module that can be replicated in other low and middle, and some of the achievements that we have to date. And under the direction of very senior faculty of SOGON and ASEPA, the manuals were reviewed in order to contextualize it to the Nigerian setting. After that, we then reviewed it in the UK and approved it and got a draft for which we started the training. In order to make the training or the program sustainable, we had to create an in-country faculty that would, with the contribution of SOGON faculty, we created a faculty that trained expert trainers. A group of 20 expert trainers were trained, and those expert trainers have so far stepped down the training to healthcare. And during the training of the healthcare workers, champions were selected for advocacy. And so far, we've been able to run some JC workshops, that is gender equality, social and social inclusion workshops. And we followed through with supportive supervision and a refresher course. And we've had tremendous buy-in from both the federal government and some of the state ministries. So, the first cohort of 20 expert trainers were equally divided between Kano and Abuja. For gender inclusion, gender appointment, as someone said this one, 11 females and 9 males were included. The selection was conducted by senior faculty members of SOGON and ASEP. The training took place in July, followed by the step-down training. 180 frontline healthcare workers have received the training so far. And if you look at the graph, the diagram there, you will see the cadre of staff that we are trained, including community health workers, doctors, midwives and nurses combined. And the initial, and we anticipate that the coordinating minister for health will be launching this program so that it can be cascaded and used throughout Nigeria. Yeah, these are the stakeholders that attended the review and validation meeting, and this included personnel from UNICEF, WHO, the Nigerian Medical Council, Nursing and Midwifery Council. Like I said, we've had a Jesse Champions workshop, and actually as part of the program, we appointed a Jesse consultant here to develop Jesse actions for individual facilities. And some of the things we expect them to do will be to advocate and provide adolescent-friendly environment within their facility, and provide some safe space for discussion and disclosure of domestic violence, and also participate in educating the staff as they go along. So, what's the reason for the success so far? I think I would say it's due to excellent collaboration, engagement, partnership with SOGON and ASEPA and some of our other partners. There's been excellent organization of the program, active participation, and we've been able to identify opportunities for improvement as we get along, and has received valuable participant feedback. We continue to emphasize human rights-based approach, which entails consciously and systematically paying attention to human rights in all aspects of provision of care. This results in improved experiences and outcomes. There are 5 must-haves in human rights-based care service. That's availability, accessibility, acceptability, quality. There must be high quality care of goods and services, and medically appropriate for quality. And finally, the principle of non-healthcare providers in high quality gynecology live healthier lives throughout their lives. These are our partners: SOGON, ASEPA, the Federal Ministry of Health and Social Welfare, and then our global partners who control the fund. Okay. I would like to just mention, there are so many people involved in this project, but I would like to mention my credit, Eze and his team, and the Society of SOGON, and then of course Dr. Okere of Ministry of Health,